So I really like to ask my patients, how's your libido? And I will usually get one of three answers. It's great, it's fantastic, or meh, not as good as it used to be, but I really hate to hear, I couldn't care less if I ever had sex again. And that's sad because it's an important part of a relationship. And I like to explain to my patients that there's differences between men and women. Men can be aroused visually, and early on, women can be too. But after they get comfortable in a relationship, you really need to have more than just that visual arousement. So there's really three key ingredients you need. One, you need to be anatomically normal. Two, hormonally sound. And three, emotionally stable. These are things that we really need to delve into more deeply. The first ingredient for a robust libido for women is that they need to be anatomically normal. And the only way to tell that is to get an exam. What your doctor will look for is first to see, is the vagina healthy? A healthy vagina is pink, it's lush, it's thick, it has folds, it has elasticity, it has moisture. If any of these things are missing, that can be remedied. Your doctor will help you get back a healthy young vagina. The next thing to consider is that things change over time. Often after childbirth, women think it's just not the same and I have to live with that. And that's not the case. Again, your doctor can look and see what's happened, and there are things that can be done to help the damage that happens with childbirth. Once you address those anatomical issues, there's a really good chance that your libido will increase. The second key ingredient to a robust libido in women is being hormonally sound. We can do a simple blood test to look at your hormone levels. The hormones we're looking at are estrogen, progesterone, and testosterone. It's not just older women who have issues with their hormones. A common scenario is a young woman taking oral birth control pills. They are designed to override your system because we're trying to prevent pregnancy. But in doing that, your estrogen and progesterone levels may be zero. After menopause, it's physically impossible for you to make your own estrogen and progesterone. Testosterone can vary throughout your life, and testosterone is absolutely essential for arousal and orgasm. So it is often necessary for us to supplement these hormones. Balancing your natural hormones is the second way to increase your libido. The third key ingredient to a robust libido in women is being emotionally stable. The truth is, it's incredibly difficult for a woman to become aroused if everything isn't right in her world. She might be tired, she might be stressed, she might be angry, she could be depressed. And if you're on an antidepressant, you are going to experience issues with your libido. Most doctors aren't adequately trained to assess this aspect, and frankly, they don't have the time. I feel the most important question I can ask is, what's going on in your life? That's where I find she's a new mom and the baby's keeping her awake at night, or that job is really stressful right now. She could be secretly angry with her husband. If you're anatomically normal and hormonally sound and still experiencing low libido, the place to focus is on your emotions. Once you discover what challenges you face, you can get the help you need.